Today, we're going to unpack a story that, well, it starts with a massive financial settlement, but it quickly spirals right into the heart of the most contentious medical debates of our time. It's about fraud, a pandemic, and really, a fundamental breakdown of trust in the very institutions we're supposed to rely on for our health.
So, it all kicks off with this number, $556 million. I mean, that's just a staggering figure, right? It absolutely demands an explanation. How do you even get to a price tag this high?
Well, the answer is fraud. Specifically, this was the settlement that healthcare giant Kaiser Permanente had to pay. They were resolving allegations that they systematically defrauded the government's Medicare Advantage program. And this wasn't just any settlement. We're talking about the largest of its kind in U.S. history.
But this story is about so much more than just money. It's about a system where it looks like financial incentives might just override medical integrity. And that begs a really critical question. If an institution can be accused of manipulating patient data just to make a profit, how does that affect our trust when that same institution is giving us guidance on something as vital as a global pandemic? That's the connection we're going to explore today.
So, to really get a handle on this crisis of trust, we first have to dissect the fraud itself. Because according to the Department of Justice, this wasn't just a bunch of clerical errors. No, this was a deliberate, multi-year strategy to profit from the system.
The core of the alleged fraud was a practice known as upcoding. Now, the concept is actually pretty simple. The sicker a patient appears to be on paper, the more money the government pays for their care. So upcoding is when a provider knowingly adds diagnoses that aren't real or maybe just inflates how severe a real one is, all to get those higher payments.
And here's how it allegedly worked at Kaiser. First, they would data mine a patient's entire medical history, looking for any little hint of a past condition. Then, they'd send out what they called queries to doctors, basically nudging them to add these old conditions to the current record. And here's the crucial part. These new diagnoses were often added through retrospective addenda, months, sometimes even a whole year after a patient's visit. The result? It made them seem way sicker than they actually were.
The DOJ investigation painted a picture of a real top-down strategy. You add financial bonuses for doctors that were directly tied to meeting these risk adjustment goals. Doctors who didn't add enough of these codes were actually labeled underperformers. What's even more concerning is that internal compliance staff who tried to raise red flags were reportedly just ignored. And in many cases, the patients themselves, they were never even told about these serious conditions being added to their permanent medical records.
And for all of these really serious allegations, there was no public trial. Kaiser paid that record-breaking fine, but they admitted no wrongdoing. They used that standard legal line about wanting to avoid a prolonged court battle. So while this closed the book on the financial case, it blew the doors wide open on a much deeper crisis of trust.
This whole financial scandal, it kind of reveals a playbook, right? One based on data control and institutional pressure. And as it turns out, that very same playbook is absolutely central to the fierce scientific and political battles of the COVID era.
And that brings us to the medical debate. See, while the world was pretty much focused on case numbers and mandates, there was a completely different conversation happening in some scientific circles, one that was challenging the official narrative by looking a lot closer at the very building blocks of the virus and the vaccines.
At the dead center of this debate is the spike protein. Now, whether it comes from the virus itself or is produced by our own cells after an mRNA vaccine, some researchers have raised some really serious concerns. There's peer-reviewed literature out there that describes the spike protein as a biologically toxic molecule all on its own, one that's highly inflammatory and apparently has the ability to cross that protective blood-brain barrier.
And pretty soon, those concerns started to pop up in the data. What you're looking at here is a preprint analysis of VAERS. That's the government's official vaccine adverse event reporting system. It found what it called unprecedented safety signals for neuropsychiatric conditions. I mean, just look at this. Compared to the flu vaccine, reports of cognitive impairment were 118 times higher. Psychiatric illness, 115 times higher. And reports related to suicide or homicide were a staggering 80 times higher.
Other researchers, they took a different tack. One analysis, published back in 2021, went back to the original clinical trial data from the vaccine manufacturers themselves. But instead of just looking at COVID infections, it analyzed all-cause severe morbidity. That means every single serious health event that happened. And its conclusion was, it was stark. The analysis found a statistically significant increase in severe events in the vaccinated group compared to the placebo group. So this collision of a financial scandal and this growing medical debate,
It didn't just happen in a vacuum. It actually fueled a massive political backlash that has led to a pretty much unprecedented reorganization of America's public health institutions.
And the timeline of this shift has just been incredibly fast. In late 2024, the House Coronavirus Subcommittee drops its final report, alleging that core pandemic policies like 6-foot social distancing were totally arbitrary. By mid-2025, the new Secretary of Health and Human Services had fired the CDC's entire vaccine advisory board. Then, in January 2026, the CDC rolls out the new Kennedy schedule, which moved the COVID vaccine from being universally recommended to a category of shared decision-making. And that immediately triggered a lawsuit from 15 states trying to force the government to reverse course.
In this whole battle for accountability, it hasn't just been about policy changes. It's also gone global and legal. As of early 2026, key figures from the pandemic era are facing active investigations, and not just here in the US, but internationally. The charges being looked at are serious stuff. We're talking obstruction of justice, institutional bribery, and even racketeering.
This political and legal reckoning, though, it hasn't resolved the debate. Not at all. Instead, it has created this deep, painful schism, basically transforming the country into a medical battlefield and trapping major healthcare providers right in the middle of the crossfire.
Which brings us right back to Kaiser Permanente. Because despite the new federal guidelines from the CDC, as of 2026, Kaiser is still recommending the COVID-19 vaccine for pretty much everyone, all the way down to 6-month-old infants. This puts them in direct opposition to the new federal stance.
This whole situation has created a kind of three-way standoff. You've got the federal level where the new policy emphasizes shared decision-making and informed consent. Then you've got powerful states like California suing, calling the federal shift unscientific. And who's caught right in the middle? Kaiser, which has sided with the states, maintaining its policy of universal recommendation.
So you have to ask, why would Kaiser defy the new federal guidance? Well, sources seem to point to three main reasons. First, they're a California-based organization, so it makes sense they'd align with state law. Second, institutionally, they're standing by the recommendations of their own internal expert panels and their long-running vaccine study center. And third, well, there's a business model to consider. For an organization of its size, a universal policy of mass vaccination is often just seen as more cost-effective than a nuanced, individual approach to care.
And this really brings us to the core tension we're seeing today. Providers like Kaiser are literally trapped between two powerful opposing forces, a federal push for medical autonomy and individual consent on one side versus a state-level push to enforce what they define as mandatory public health on the other. It is a legal and ethical minefield.
Which leaves us with this one final, critical question. The Kaiser fraud case, it started with a breach of financial trust, but now that has escalated into a full-blown crisis of medical authority. When the CDC, state governments, and massive healthcare systems are all in open disagreement, who gets to define what is true?
And maybe more importantly, in a system that is so fractured, who can a patient truly trust? That is the unresolved question right at the heart of America's healthcare crisis in 2026.